Uncertainty and not knowing what's going on is probably the biggest challenge that I see. I'm Dr. Jerrie Refuerzo. I am a maternal-fetal medicine specialist in the Division of Fetal Intervention at UTHealth Houston, the Fetal Center. So women who come to the fetal center are typically diagnosed with a fetal anomaly or a birth defect or a genetic condition. And when they come here, obviously they're devastated, their pregnancy has been changed. And so when they come to me, I take over their prenatal care, I do their delivery, and I take care of them in the postpartum period. But when they come to us, what we have found is that even though they may not have a maternal problem, they are struggling. Many times we help them through the process of having fetal interventions, meaning that they have surgeries or treatments while they're pregnant, while the fetus is still in the womb. And so as you can imagine, that mom and their family, their husbands, their whole family, they struggle through that entire process. So our goal is not to just provide routine prenatal care. What we do is we really try to take care of the whole family as they're going through this process. I'm kind of like the link between the fetal world and the newborn world. And so when we are developing a birth plan for these patients, it's really important to me that I line these up with the requirements of the fetal surgeons and the expectations of the pediatric specialists. But it doesn't end there. For a lot of obstetrical practices, the delivery is done, they move on to the next patient. But what I find is that the journey continues for these families even after the cord is clamped. Because it's not just medical, it's just not scientific, the emotional and mental component is very real. One of the unique things about our practice and one of the things that I really enjoy about being here in the Fetal Center is I get to work with amazing people. And I've seen them do groundbreaking things that will impact that baby for the rest of its life.